My name is Dr. Chaand Nagpaul. I'm a GP practicing in North London for the past 33 years. I'm past chair of the British Medical Association Council, and which I concluded my term just in the end of June. And I'm also a member of the NHS Race and Health Observatory, and I chair the British Medical Association's Racial and Ethnic Minority Forum. My presentation highlighted the NHS's values of providing care equally to all citizens, regardless of background, and the fact that sadly, when it comes to ethnic minority staff and also ethnic minority patients, that principle is sadly not often applied, with disparities, discrimination and inequalities. And my speech was about, first of all, recognizing and understanding exactly this reality, the fact that racism in medicine, because I'm a doctor representing doctors, is affecting the lives of individuals, but more importantly, it's also affecting patient care, and it's also affecting the workforce in terms of recruitment and retention. So this has to be a national priority if we are to have a health service that can bring out the best of its workforce at a time of unprecedented pressure. And at a time, if we do not tackle racism in the healthcare workforce, we're likely to see people leaving or actually retiring early, and that's the feedback we're getting. I think addressing racism in the NHS has to be a national priority, starting from government. We have a health service now under the greatest strain it's ever had, and we have a workforce, with regards to doctors, 42% come from an ethnic minority. And out of that 42% of doctors, they are experiencing, large numbers are experiencing racism, they're experiencing incivility, it's affecting their mental health, it's affecting their work, many are off sick, and many are leaving the health service. So it's really important that we tackle this so that we get a motivated workforce. You retain doctors, you draw doctors in and other healthcare professionals so that you can actually get the best out of everyone, and that will ultimately be of benefit to the care of patients. At the moment, we have a health service that is effectively dumbing down many healthcare professionals, preventing them from progressing in their careers, preventing them from being their best, and actually patients are losing out, as well as, of course, the toll it takes on individuals to be experiencing discrimination and incivility. If anyone wants to see any of the statistics of the work that I've led whilst being BMA Council Chair, please go onto the BMA website and type in BMA Racism in Medicine, and you'll see the work we've done, and the data will be there for all to see. The scale of disadvantage and inequalities of experience of ethnic minority doctors is sadly, a stark picture. And what was so upsetting when you actually look at this was the data is very much going under the bonnet of some of the headline figures we've seen before. So we have a picture, a reality of doctors from ethnic minorities going into work feeling that they're being over-scrutinized compared to their white colleagues, feeling that they're actually being considered to be more junior roles because of their color compared to their white colleagues, feeling excluded from their peers when they're actually in a ward or in a GP practice. Feeling that they are getting more derogatory comments, and then feeling that when they get those derogatory comments, they have nowhere to turn because their managers won't support them. And when you add all of that up together, that takes a huge toll on individuals. It makes many doctors feel, 60% feel that their well-being is affected, is making many go off sick. It's actually reducing their confidence. It affects their family lives. So in fact, it's so important that we address these structural workplace experiences, these microaggressions, these micro experiences, because actually this is not just affecting the well-being of doctors, it's affecting their ability to provide the best possible care they can. And this should be a national responsibility, because we're not getting the best out of our workforce. What I really think is so important about an organisation like UPNA is that it's inclusive. It's actually not just speaking on behalf of doctors that I represent. It's actually bringing together the entire NHS workforce, a network of everyone who works in the NHS of South Asian origin. And I think that collectively, we are actually part of one team. That's what the NHS is. And we should be working as one team. And I think that collective approach of all NHS professionals working together I believe, can speak with one voice, but coming up with real tangible solutions and practical steps, which I believe are there, carries much more chance of success than actually each of us trying to, approach it from an individual basis. So I think UPNA has huge potential of bringing together a collective voice of healthcare professionals of South Asian origin that make up a huge proportion of the NHS workforce. I think this conference has been, an incredible success because it's brought healthcare professionals together. I mean, I've been used to as a doctor going to events comprising of other doctors, but actually it's been so great to be part of an event where I'm spending time and meeting and engaging with other South Asians from all denominations and backgrounds, whether they're doctors, nurses, staff working on wards, managers. And I believe that this networking, also offers opportunities for solutions and solutions that are coordinated, because actually you can't solve the issues and racism in the NHS, but in a piecemeal approach. The way you approach it is a collective, whole system approach, and UPNA bringing together the range of professionals and staff that work in the NHS, therefore is in a very strong position to promote these system-wide solutions. And that's what the focus of UPNA, I believe, should be. And I look forward to next year's conference being really a conference where we don't speak about the problems so much, which we know are there, but we speak about exactly how we make change. And what I think UPNA can also do is celebrate and promote positive change where it occurs, to get good practice, disseminate it, and really, act and allow beacons to share that good practice so that it can spread further wide. And I think the other thing that people forget is that when you actually do have success, when you have organizations that are inclusive, that actually bring people together, that address inequalities, actually those organizations are more productive. They're more happy for everyone, including, whether you're a white staff member or an ethnic minority staff member. These organizations just give everyone a sense of greater motivation and achievement. So I would like UPNA to be a vehicle to show what success looks like, and to provide the mechanisms and disseminate good practice to achieve that success.